Hello students, subscribe the Fundamental Pharmacy and press the bell icon for more videos.
Hello students, join our online course for GPAT Niper Drug Inspector to get assured amazing rank.
Hello my dear students, welcome back to the Fundamental Pharmacy. Today we are going to see another knowledge booster dose, that is a knowledge booster dose part 25, pinpoints from pharmacology. Particularly we are going to see metabolism of drug, different prodrugs and different drugs and their active metabolites. This knowledge booster dose is very important for your upcoming GPAT Niper Drug Inspector and Government Pharmacist exam. So I would like to request you, please watch this video until end. My dear students, we have already seen 24 parts of knowledge booster dose. If anybody has not seen previous knowledge booster dose parts, please go in the channel's playlist and watch all the previous knowledge booster dose parts, because they are really important for your upcoming GPAT Niper Drug Inspector Government Pharmacist exam. And believe me, a lot of MCQs they are going to be covered just by watching these pinpoints or knowledge booster dose videos. My dear students, before starting the actual topic, you should know what do you mean by metabolism or what do you mean by biotransformation. Metabolism is also known as a biotransformation. Metabolism को ही biotransformation बोलते हैं. And what is metabolism? Metabolism is nothing but the inactivation of drug in the body. आपके बॉडी में ड्रग का इनएक्टिवेशन हो जाएगा, ड्रग का एक्टिव नहीं रहेगा, उसको बोलेंगे मेटाबॉलिज्म. Now what is the technical definition of biotransformation? Now this biotransformation is made from a two word. देखो bio is for biological system. Transformation is nothing but the alteration of one form into another form. So what will be the technical definition of biotransformation? Biotransformation is nothing but the transformation or alteration of drug inside the body from one form to another form. So alteration of drug from one form to another form in the body is known as a biotransformation. What is the main aim of biotransformation? Main aim of biotransformation or main aim of metabolism is nothing but the inactivation of drug. Again, another main aim. So for absorption you need a water insoluble, or that is a lipid soluble drug. But for elimination from the body you need a water soluble drug. So main aim of biotransformation is nothing but the, or main aim of metabolism is nothing but the conversion of lipid soluble drug into water soluble drug. इसके ऊपर भी क्वेश्चन आ चुका है, right? There are different organs in your body which has a different capacity to metabolize the drug. आपके बॉडी में बहुत सारे organs है जो ड्रग को मेटाबोलाइज कर सकते हैं. What are the different organs in your body which can metabolize the drug? So first one is nothing but the liver. Liver has the highest capacity to metabolize the drug. इसके ऊपर भी क्वेश्चन आ चुका है. So most of the drugs they are metabolized, they are inactivated by liver. So liver has the highest capacity to metabolize the drug. After liver, kidney is there, then lungs are there, then GIT are there. Drugs are metabolized in the various body organs like your liver, lungs, kidney, then GIT, then skin. Okay, so different organs have different capacity to metabolize the drug. But remember, liver has the highest capacity to metabolize the drug. Now, after the metabolism, what are the different outcomes of metabolism? Metabolism of drug और metabolism of drug, ड्रग का मेटाबॉलिज्म होने के बाद में उसके साथ में क्या हो सकता है, क्या क्या पॉसिबिलिटीज है. सो व्हाट आर द डिफरेंट आउटकम्स ऑफ ड्रग? सो फर्स्ट आउटकम ऑफ ड्रग इज नथिंग बट द इनएक्टिवेशन ऑफ ड्रग. फर्स्ट आउटकम इज नथिंग बट द इनएक्टिवेशन ऑफ व्हाटएवर ड्रग इज यू आर टेकिंग, सो दैट विल बी इनएक्टिवेटेड इन द बॉडी. आपका जो एक्टिव ड्रग है उसका इनएक्टिवेशन हो सकता है, राइट? सो इनएक्टिवेशन ऑफ ड्रग, इनएक्टिवेशन ऑफ एक्टिव ड्रग. फॉर एग्जांपल, इनएक्टिवेशन ऑफ क्लोरोफेनिकॉल by conjugation reaction. That is the example of inactivation of active drug. Inactivation of chloramphenicol or inactivation of another drug also. Now second outcome of metabolism. Metabolism का second outcome क्या हो सकता है? Activation of inactive drug. Activation of inactive drug. Activation of inactive drug to the active drug, or you can say activation of prodrugs. Now what do you mean by prodrugs? Prodrugs क्या होते हैं? Prodrugs, these are nothing but the drugs which are not active as such. Prodrugs क्या होते हैं? Inactive drugs होते हैं. Prodrugs are inactive drug and they are activated inside the body after metabolism. Prodrug ऐसे ड्रग होते हैं कि जो inactive होते हैं, उनको कोई एक्शन नहीं होता, बट बॉडी में जाने के बाद में उनका मेटाबॉलिज्म होता है और वो प्रोड्रग से एक्टिव ड्रग बनता है. सेकंड आउटकम ऑफ मेटाबॉलिज्म इज नथिंग बट द एक्टिवेशन ऑफ इनएक्टिव ड्रग. नाउ एक्टिवेशन ऑफ इनएक्टिव ड्रग, इट कैन बी एट टू टाइप्स. ठीक है, एक्टिवेशन ऑफ इनएक्टिव ड्रग which will be of two types. First one is a therapeutically useful. First one is a therapeutically useful. So therapeutically useful activation of prodrugs. Example is nothing but the levodopa to dopamine. So levodopa is a prodrug and it is converted into dopamine. So levodopa is a drug used in the Parkinsonism. What is Parkinsonism? Parkinsonism क्या होता है? So in the Parkinsonism there is a degeneration of dopamine containing neurons, or there is a degeneration of dopaminergic neuron in the nigrostriatal tract. As there is a degeneration, there is a lack of dopamine in the body. Dopamine का deficiency होता है, and to replenish that dopamine, you have to use dopamine precursor. That is a levodopa is a prodrug of dopamine. So it is converted into dopamine inside the body. Again, another example of activation of prodrugs, that is inapril is a prodrug which is activated and converted into inapril. Now what is inapril? Inapril क्या होता है? Inapril is a drug used in the hypertension. Inapril is a drug used in the hypertension, right? So ये hypertension में use किया जाता है. It is known as a ACE inhibitor, angiotensin converting enzyme inhibitor. तो इसका it is a prodrug and it is converted to inaprilate. Remember, inaprilate is the active therapeutically useful. Toxicological activation. For example, parathion. Parathion क्या है? It is a pesticide. Parathion is a pesticide and itself it is a toxic in nature, but it is a less toxic. It is converted into body one metabolite known as a paraxone. और paraxone is a more toxic than parent compound. Paraxone क्या है? इससे भी ज़्यादा toxic है. Parathion से भी ज़्यादा toxic है. So toxicological activation. Okay. So parathion is a less toxic than paraxone. Parathion is a pesticide. ये pesticide होता है, ये toxic होता है, लेकिन body में जाने के बाद में और भी ज़्यादा toxic metabolite बनता है. So toxicological activation. So what is the outcome of metabolism? First outcome is the inactivation of drug. Second outcome is the activation of prodrugs. Third outcome is nothing but the generation of active metabolite from the active drug. Active drug ले लिया आपने, उसका भी एक metabolite बन सकता है body में. So third outcome. For example, in that also you have two types. So generation of active metabolite from active drug, more active than parent compound. So generation of active metabolite from active drug which is having more activity or more active. So for example is nothing but the diazepam is converted into oxazepam. Diazepam is converted into oxazepam. So diazepam is nothing but it is a sedative hypnotic drug belonging to benzodiazepine category. Now this drug is metabolized inside the body and converted into one metabolite known as oxazepam. वैसे तो diazepam metabolism okay दो metabolite बनता है. Diazepam is converted into two metabolites, oxazepam and temazepam. Okay, so diazepam is converted into one active metabolite known as oxazepam, which is more active than parent compound, which is more active than diazepam. So diazepam का conversion oxazepam में होता है body में. Oxazepam क्या है? ज़्यादा active होता है diazepam से. Again, generation of active metabolite of active drug which is having different activity. For example, pethidine. Pethidine is nothing but is a narcotic analgesic. Pethidine क्या है? Narcotic analgesic. So pethidine has a CNS depressant effect. Now this pethidine after metabolism is converted into one drug known as a norpethidine. Pethidine का conversion norpethidine में होता है. And pethidine is a narcotic analgesic which is having CNS depression action, but norpethidine is having CNS stimulation action. Okay. So first outcome of your metabolism is inactivation of drug. Second outcome is the activation of prodrug. In that also activation of prodrug which is therapeutically useful. Activation of prodrug which is toxic. That is toxicological activation. Generation of active metabolite from active drug. So generation of active metabolite from active drug which is having more activity, like diazepam is converted into oxazepam. And generation of active metabolite from active drug which is having different activity, like pethidine is a CNS depressant drug and it is converted into norpethidine. Norpethidine is a CNS stimulant drug. Now we'll see what are the different examples of prodrugs. इसके ऊपर बहुत बार क्वेश्चन आ चुके हैं GPAT में. So we'll see different prodrugs. Prodrugs, their active metabolite, then prodrugs and active metabolite. So first is nothing but the inapril. So as I told you, inapril is nothing but the ACE inhibitor and it is converted into one active form known as inapril. So you can say inapril क्या है? Prodrug है. Inapril क्या है? उसका active metabolite. Then another example is the alpha methyl dopa. So alpha methyl dopa is a सेंट्रल एंटी हाइपरटेंसिव ड्रग, ये क्या है, सेंट्रली एक्टिंग एंटी हाइपरटेंसिव ड्रग होता है. इट इज कन्वर्टेड टू अल्फा मिथाइल नॉर इपिनेफ्रिन, अल्फा मिथाइल नॉर एड्रेनालिन. So alpha methyl topper is a product converted to alpha methyl norepinephrine. Another example is the dipiveprin. Dipiveprin is another synthetic derivative of your norepinephrine. Dipiveprin is converted to epinephrine. Dipiveprin is a product which is converted to epinephrine. Epinephrine मतलब adrenaline. देखो adrenaline is known as a epinephrine, noradrenaline is known as a norepinephrine. So dipiveprin is converted to epinephrine. Now another drug is there, Sulindac. Sulindac is nothing but the non-steroidal anti-inflammatory drug. It is used in the treatment of rheumatoid arthritis. Right? So it is converted into one metabolite known as a sulfide metabolite. Now next drug is a proguanil. Next drug होता है proguanil. So proguanil is a drug used in the treatment of your malaria. So it is converted into one metabolite known as active metabolite cycloguanil. So product proguanil is extra active metabolite होता है cycloguanil. Now another drug is there known as a prednisolone. Prednisolone is the steroidal anti-inflammatory drug. ये क्या है, steroidal anti-inflammatory है. It is converted to active metabolite known as a prednisolone. तो इसके ऊपर क्वेश्चन आ चुका है, ठीक है. prednisone का एक्टिव मेटाबोलाइट होता है prednisolone. proguanil का एक्टिव मेटाबोलाइट होता है cycloguanil. Prednisone is a prodrug of prednisolone. Proguanil is a prodrug of cycloguanil. You have to remember. Okay. Now another drug is there known as a bicampicillin. So bicampicillin is nothing but it is a type of penicillin. It is a penicillin. Bicampicillin is converted into ampicillin inside the body. तो bicampicillin का active metabolite कौन है, ampicillin. Bicampicillin क्या है, prodrug. Another example is there, you can say over here, p-vampicillin. P-vampicillin is also a penicillin and it is converted into ampicillin. So p-vampicillin, bicampicillin, then amoxicillin. ये तीन होता है, देखो बिकाम्पिसिलिन, पिवाम्पिसिलिन एंड अमोक्सिसिलिन. सो ये तीनों का भी एक्टिव मेटाबोलाइट कौन है, एम्प्लिसिलिन. पिवाम्पिसिलिन, बिकाम्पिसिलिन एंड अमोक्सिसिलिन. ओके. नाउ नेक्स्ट विल सी, नेक्स्ट ड्रग इज अ सल्फासैलाजिन. सल्फासैलाजिन क्या है, इट इज अ सल्फोनामाइड. सल्फासैलाजिन इज नथिंग बट द सल्फोनामाइड and it is a combination of sulfonamide plus salicylic acid. So it is the prodrug. Sulfasalazine is a product and it is converted into 5 amino salicylic acid plus क्या है, sulfonamide. Sulfanilamide plus 5 amino salicylic acid. So sulfasalazine is made up of two components. sulfasalazine में sulfonamide भी है, sulfonamide भी है and 5 amino salicylic acid. So it is a drug used in the ulcerative colitis. Ulcerative colitis में ये यूज किया जाता है inflammation of your GIT, right? GIT का lower part जो होता है आपका rectum, उसमें अगर inflammation है तो ulcerative colitis में ये drug of choice sulfasalazine, because it liberates two components. So it is broken down into the GIT by azoreductase enzyme and वहाँ पे azoreductase enzyme इसको break down करेगा, एक component बनेगा आपको sulfonamide, दूसरा component बनेगा amino salicylic acid. So amino salicylic acid will exert its anti-inflammatory effect over there. So it is used in the ulcerative colitis. Next drug is a cyclophosphamide. So इसके ऊपर GPAT 2023 में भी क्वेश्चन आ चुका है, पहले भी क्वेश्चन आ चुका है. So cyclophosphamide is a prodrug. What is cyclophosphamide? It is an anti-cancer drug known as a alkylating agent. Cyclophosphamide is an anti-cancer drug known as a alkylating agent and it is converted into, it is a prodrug, it is converted into metabolite known as a aldophosphamide. So aldophosphamide is the active metabolite of cyclophosphamide. You can say phosphoramide mustard is also active metabolite of cyclophosphamide. But there is a one toxic metabolite generated from this cyclophosphamide known as acrolein. So this acrolein is also toxic metabolite generated in the cyclophosphamide. Now ये acrolein, ये toxic metabolite क्या करता है? This acrolein causes the hemorrhagic cystitis. Major adverse effect of this cyclophosphamide, which is a prodrug of aldophosphamide, phosphoramide acid, is nothing but the hemorrhagic cystitis. So that is caused due to formation of this acrolein metabolite. Now to prevent that hemorrhagic cystitis, one drug is used known as a mesna. Mesna is used to prevent the hemorrhagic cystitis caused by cyclophosphamide. Now what is mesna? Mesna is nothing but the markaptoethane sodium salt of sulfonic acid. Markaptoethane sodium salt of sulfonate. That is a मेसना. So remember cyclophosphamide का adverse effect होता है hemorrhagic stasis and that is prevented by using mesna. क्यों होता है? Because cyclophosphamide is a prodrug. It is converted into aldophosphamide, phosphoramide mustard. During this conversion, there is a generation of one toxic metabolite known as acryloin. Acryloin will cause hemorrhagic stasis, and to prevent the hemorrhagic stasis, mesna is the drug used. Okay. Now another example of prodrug. Fluorouracil is the prodrug. Fluorouracil क्या है? Prodrug है. So it is converted into active metabolite known as a fluorouridyl monophosphate. Fluorouridyl monophosphate, okay, which will inhibit the DNA synthesis, right? Another example of prodrug, marcaptopurine. Again, all these cyclophosphamide, fluorouracil, marcaptopurine, all these are the anti-cancer drugs. Marcaptopurine is a prodrug converted into methyl marcaptopurine ribonucleotide, that is active metabolite. Another drug, acyclovir. Acyclovir is a antiviral drug. Acyclovir क्या है? Antiviral drug. It is a prodrug. It is converted into active metabolite known as a acyclovir triphosphate. इसके ऊपर GPAT में क्वेश्चन आ चुका है. Acyclovir is a prodrug known as an antiviral drug which inhibit the DNA synthesis in the virus, and active metabolite is a acyclovir triphosphate. Now another we'll see another antiviral drug is there known as a ganciclovir. Valacyclovir. Valacyclovir is the prodrug converted into acyclovir. ये देखो acyclovir का एक्टिव मेटाबोलाइट क्या है? acyclovir ट्राइफॉस्फेट. वेलासाइक्लोविर क्या है? प्रोड्रग है. उसका एक्टिव मेटाबोलाइट क्या है? acyclovir प्रोड्रग. व्हेन वेलागैनसाइक्लोविर इसका एक्टिव मेटाबोलाइट होता है गैनसाइक्लोविर. Valganciclovir is a product converted into ganciclovir. Then next drug is simvastatin. Simvastatin. So it is a statin derivative known as a HMG-CoA reductase inhibitor used in the treatment of obesity to decrease the cholesterol level. So statin जो होते हैं HMG-CoA reductase inhibitor है, hydroxymethyl ultraryl-CoA reductase inhibitor. So that will prevent the de novo synthesis of cholesterol. आपके बॉडी में जो कोलेस्ट्रॉल बनता है उसका सिंथेसिस इनहिबिट करने वाले ड्रग होते हैं स्टैटिन्स. लोवास्टैटिन, परवास्टैटिन, सिमोवास्टैटिन, these are the drugs. Simvastatin is a prodrug. It is converted to active metabolite known as a beta hydroxyl acid derivative. Another drug is there, ramipril. So ramipril is also ACE inhibitor, like your inapril. Ramipril is also converted into active metabolite ramiprilate. Then another example, Tegafur. Tegafur is a drug. Then capecitabine. Tegafur is an antiviral drug. Capecitabine is a again alkylating agent, anti-cancer drug. So Tegafur, capecitabine, both are converted into active metabolite known as a fluorouracil. So 5-fluorouracil is the active metabolite of Tegafur and capecitabine. Tegafur and capecitabine, they are the prodrugs. Now omeprazole. Omeprazole is nothing but it is known as a proton pump inhibitor. ये क्या करता है? It is an anti-secretory agent. ये acid नहीं बनने देगा stomach. Omeprazole, rabeprazole, pantoprazole, esomeprazole, dextromethorphan. So all these are nothing but the proton pump inhibitors. All these are the prodrugs. Proton pump inhibitors are the prodrug. So what is the active metabolite? Sulfenamide. Sulfenamide is the active metabolite. Sulfenamide is the active metabolite of all proton pump inhibitors. So omeprazole is converted into omeprazole sulfenamide derivative. याद रखो आप. Nabometone. Nabometone is a NSAID, non-steroidal anti-inflammatory drug. So it is converted into one active metabolite known as a 6-methoxynaphthalic acid. Then phosphantoin. Phosphantoin क्या है? It is a phenytoin ester. Ester of phenytoin with phosphoric acid. क्या है ये? Ester of phenytoin with phosphoric acid. So it is a prodrug. Phosphantoin is a prodrug, and it is converted into phenytoin. Now next one is a bambuterol. Bambuterol क्या है? Drug used in the asthma. Bambuterol अस्थमा में यूज किया जाता है, and it is a prodrug. It is converted into theophylline. So theophylline is an active metabolite of bambuterol. Next drug is nothing but allopurinol. Allopurinol क्या है? It is a xanthine oxidase inhibitor. ये क्या करेगा? It will prevent the formation of uric acid. So it is used in the treatment of gout. Allopurinol is a xanthine oxidase inhibitor. So it is a prodrug and converted into oxypurinol metabolite. Now codeine. Next one is a codeine. Codeine is nothing but the narcotic analgesic. Morphine, codeine, thebaine, cocaine. Morphine, codeine, thebaine. So out of that, more codeine is nothing but the prodrug, or codeine is converted into morphine. You can say morphine is the active metabolite of codeine. 10 milligram of codeine, 10 milligram of codeine is converted into 1 milligram of morphine. So every 10 milligram of codeine phosphate you are using for purpose or for analysis purpose, so it is being converted into 1 milligram of morphine. तो बॉडी में 10 मिलीग्राम कोडिन ले लिया, उसका कन्वर्ट होता है बॉडी में 1 मिलीग्राम ऑफ मॉर्फिन. मॉर्फिन इज एक्टिव मेटाबोलाइट ऑफ कोडिन. विल सी द नेक्स्ट वन, एक्टिव ड्रग्स एंड देयर एक्टिव मेटाबोलाइट. एक्टिव ड्रग कौन सा है, उसका एक्टिव मेटाबोलाइट कौन सा है. फर्स्ट वन इज नथिंग बट द एक्टिव ड्रग एंड देयर एक्टिव मेटाबोलाइट. एक्टिव ड्रग एंड देयर फर्स्ट वन इज नथिंग बट द क्लोरल हाइड्रेट. क्लोरल हाइड्रेट क्या है, इट इज नथिंग बट द sedative hypnotic. Chloral hydrate is a alcohol derivative known as a sedative. So it is converted into one metabolite known as a trichloroethanol. Now this was again a question in GPAT. इसके ऊपर GPAT में क्वेश्चन आ चुका है. Trichloroethanol is a active metabolite of chloral hydrate. ये क्या है, it is a sedative hypnotic drug. Then next, morphine. Morphine is converted into morphine 6-glucuronide. So the active metabolite of morphine is nothing but the morphine 6-glucuronide. Morphine 6-glucuronide is the active metabolite of morphine. Codeine is converted into morphine. We are seeing that. Cefotaxime. Cefotaxime क्या है? Cefotaxime is nothing but the cephalosporin derivative. It is a third generation cephalosporin derivative. Cefotaxime. So it is converted into diacetyl cefotaxime active metabolite. Allopurinol is nothing but the xanthine oxidase inhibitor. It is converted into alloxanthine active metabolite. Procanamide is a anti-arrhythmic drug. Procanamide जो है, it is a class 1 anti-arrhythmic drug. जो class 1 anti-arrhythmic drug होता है procanamide, sodium channel blocker. Okay? So it is converted to one active metabolite known as N-acetyl procanamide. N-acetyl procanamide. Now primidone. Primidone is a sedative hypnotic drug. It is converted into active metabolite known as phenobarbital. Primidone का conversion phenobarbital होता है. So you can say that phenobarbital is the active metabolite of primidone. Then phenyl malonamide. So primidone is converted to two metabolites. Primidone is converted to phenobarbital and phenyl malonamide. दो मेटाबोलाइट होता है, ठीक है. Now again digoxin. Digoxin is a drug used in the congestive cardiac failure. This is a cardiotonic drug. Digoxin is converted to, okay, digitoxin is a cardiotonic drug. It is converted to digoxin. तो digitoxin का active metabolite कौन है, digoxin. Then imipramine. Imipramine क्या है? It is a tricyclic antidepressant. Imipramine is a tricyclic antidepressant. Now it is active drug itself. It is converted into active metabolite known as a desipramine. Amitriptyline again, it is a tricyclic antidepressant converted into nortriptyline. Amitriptyline का metabolite कौन सा है active? Nortriptyline. Spironolactone is a potassium sparing diuretic. You know that it is converted into one active metabolite known as canrenone. कैनरेनोन, इसके ऊपर भी जीपैट में क्वेश्चन आ चुका है. नॉर्ट्रिप्टिलिन के ऊपर क्वेश्चन आ चुका है. सो मॉर्फिन 6-glucuronide उसके ऊपर भी क्वेश्चन आ चुका है. ओके, प्राइमिडोन के ऊपर क्वेश्चन आ चुका है. सो स्पाइरोलेक्टिन इज अ डायरेटिक नोन एज पोटेशियम स्पेरिंग डायरेटिक कन्वर्टेड इनटू एक्टिव मेटाबोलाइट कैनरेनोन. आपका एसिटिल सैलिसिलिक एसिड एस्पिरिन इज कन्वर्टेड इनटू एक्टिव मेटाबोलाइट सैलिसिलिक एसिड. नेक्स्ट इज नोहोकेनामाइड. नोहोकेनामाइड is a local anesthetic. Procanamide वगैरह जैसा. Nohocanamide is a local anesthetic. It is converted into active metabolite known as N-acetyl nohocanamide. So these are the different active drug and their active metabolites. You can order this magic bullet for GPAT Niper DI Pharmacist exam. Read 2-3 times before exam and qualify 100%. You can order this form. You can see we have very much promising results. Thousands of students, they are placed in the Niper just by reading these books. And from these fundamentals of GPAT Niper DI Pharmacist, from a single book, every year in the GPAT exam, 50 plus MCQs, they are being covered by fundamentals of GPAT. Whatever theory portion is given in that book. And every year in the Niper exam, 100 plus MCQs that can be covered by just reading these books. You can also join our GPAT Niper 2024-25 online batch, where you will have live lectures, recorded lectures, study material, online test series. Everything is there in 8,000. And if you get all India rank below 20, अगर आपका जीपैट में 20 से कम रैंक आता है तो your fees will be written in the form of reward.
Hello students, order the magic bullet for GPAT Niper Drug Inspector, read twice and qualify 100